We have already discussed the last of these guidances, the mobile medical apps. We will continue now reviewing others that were created per impetus by the FT Asia proposed topics in need of clarity. You may be wondering why these two in a course about FDA's regulatory oversight of mobile health. Why does general wellness and medical device accessory matter when we are focused specifically on mobile health technology such as software and other devices and sensors? Well, remember there are now over 165,000 health-related mobile apps just in your Google Store or App Store by Apple. And the overwhelming majority are in the wellness category. Also, with smartphones and mobile devices as a platform, a mobile strategy is increasingly in the agenda for medical device manufacturers that are thinking about possible ways to increase value of their traditionally regulated technologies, reduce competitive threats for the traditionally non-connected devices, and much more. And so increasingly they're thinking about apps and other software to become an accessory to their existing technologies. Let's begin with the general wellness guidance. And as usual, let's start with the definition according to the FDA. A general wellness product is, according to the FDA, a product that meets these two factors, starting from the bottom, presents a very low risk to user safety. It's not an implantable, it's not something that creates abrasions on the skin, it's not something that creates risk for the user in any way, independent from the intended use, and is intended for only general wellness use. Importantly, to be considered general wellness, a reference to any disease is either not made, or if it is made, it's in a way obvious, meaning, for example, that is understood through credible and well-known independent studies, it's accepted by physicians or other key influencers and opinion leaders on the matter. And equally importantly, when a reference to any disease is made, it's a healthy lifestyle that is correlative to the disease. It's not the product. Here is how the FDA explained the definition in more details. As you can see, paramount is that the technology to be considered general wellness product is safe. And then once it's established that it poses no risk for the user, we have to see whether or not it is referencing any particular disease or condition. And if it does so, then we need to establish that there is independent knowledge associating the condition with the healthy lifestyle that is promoted by the general wellness product. Here are some simple examples to better understand how one might draw the line between a general wellness app, for example, and a medical mobile app. If the app promotes activity and a healthy weight with no reference whatsoever to the condition such as diabetes, then it's a general wellness app. It is generally well understood that promoting a healthy weight might help in reducing the risk of diabetes, so perhaps a company can be persuaded to include that association in the description of the app. However, if it suddenly starts claiming that the app treats or diagnoses type 2 diabetes, then this is clearly within the scope of regulatory oversight as a medical mobile app at the top of the triangle. If the general wellness app reduces threats with heart disease, with no indication of the potential for reduction of heart attack episodes, then everything is all right. But the moment the manufacturer decides to market the app as one that prevents the onset of such events, then it bleeds into the regulated landscape. A general wellness app may promote healthy eating behavior, and that's understood to help, for example, diminish bloating or other sensation of uncomfortable pain in people who have IBS. But obviously, a very different beast is an app that cures Crohn's disease. And at last, there are several apps that promise to improve mental acuity in golden years. But beware not to claim delay of cognitive impairment without demonstrated data that this is achieved through utilization of the app and without going through the necessary regulatory requirements. If this all seems new, well, it isn't, and it most certainly does not affect only the mobile health industry. As an example, consider the 2009 warning letter sent to General Mills, where the FDA notes that Cheerios is misbranded in a way that makes a cereal sound like a drug to prevent, mitigate, and treat high cholesterol and heart disease. Nothing to do with mobile health, just general common sense, if you will. The FDA did and still does allow a health claim linking soluble fiber from whole grain oats with a lower risk of coronary heart disease, and also to include, perhaps as part of that statement, a note about lowering cholesterol levels. But according to the FDA, the Cheerios label back then inappropriately separated the heart disease and cholesterol claims. General Mills took notice and reworded the claims in a way that you can see on these slides on the right end. Today we see a more clear association between the healthy diet and the lowering your cholesterol claim. And I'm presenting here a couple of different iterations of this new messaging, the one most recent from 2017 at the bottom of the slide. Some key takeaways from the latter part of this module. The FDA does encourage the development of general wellness products, such as fitness trackers, which can empower individuals to take a more active role in managing their health. And it has done so by demonstrating the intent to a very hands-off approach to the regulation of the lowest risk products for general wellness. So long as they promote a healthy lifestyle or an association is known between the healthy lifestyle and a certain disease or condition. Oversight focus, however, does remain on products that are invasive, implanted, or in any other way pose greatest risk to patients during their use, even if for just general wellness purposes.